Do you work at Goodwill?
I do. I've been a retail and transportation and logistics executive for my career. And 2 years ago, I connected with Goodwill, and while I've worked for some great organizations, and it's been just awesome. Been the best move I've made career-wise. Just such a purposeful and mission-driven organization. So I'm a retail exec with them here in Houston.
Man, I'm a big fan of Goodwill. So what happened to your back?
When I was in high school playing basketball was my first flare-up. And about 12 years, fast forwarding from there, around the age of 30, was playing basketball again, some cardiovascular, and blew out a couple of discs, and got a decompression surgery at that point. But over the last 20 years since that surgery, I would say I've been about 80 to 85%. So very functional, flare-ups here and there, but nothing that some Advil, some rest, and some ice didn't take care of. But about a couple months ago in February, I started noticing this pain I was getting while I was driving to work, mainly because I have quite a commute to the office. And it started off in my right side, mainly my gluteal area and my right leg. Just progressed over the next couple of weeks to going from not being comfortable driving to not being able to drive, or being able to sit for extended periods of time, then not being able to stand for extended periods of time. And so a couple weeks ago, I did try a PRP injection because I was told that maybe it was caused by the facet joint. Maybe they was looking for the pain generator because I got a bunch of things going on back there with some stenosis, with some bulging disc, with some thickening of the ligament that's back there. So did that 2 weeks ago. Haven't seen many benefits from that, although I've been told it takes about 2 to 6 weeks before you see any. And then this past Tuesday, I did get my first round of epidural corticosteroid injections. I was reduced to walking with crutches for the last couple of weeks. That's got me back to where I'm walking. I got a little bit of a limp, but I am walking without it at this juncture, and it's reduced to pain. I would say at least 50%.
Okay. And can I ask a couple clarifying questions about the pain? Because
absolutely, sure.
I think you hit the nail on the head where you said there's a lot going on. I've got some stenosis, but they were wondering if the pain could be coming from the facet joints. Now, the pattern of the pain is often a giveaway. The pain that goes down the leg toward the inner knee or the inner ankle or toward the big toe, that's often from a nerve root. The pain that's mostly in your back and then kind of feels like it's in your hip and then goes to your butt and your outer thigh, that's usually the facet joint. Which one of those is you? Can you tell?
Wow, yeah, more of the latter. So it's more where initially I felt, in fact, let me back up for a moment. Before I started getting the pain driving, I told my wife, I was like, I feel like I'm feeling some pain in my hip. But it was so minor, I just kept forging ahead. So no pain in the inner leg. It's outer thigh, outer like lower calf, outer side. But I do have a little numbness and tingling, just a faint bit in my big toe.
You do?
So
okay.
I do.
Okay.
Yeah, I do. On my right side.
Oh, so you're married, huh?
I am married. Married with 3 kids, and as I was telling Phoebe, two young kids as well, an adult daughter and 2 very young kids, 3-year-old son, Christopher II, and then Christian Grace, who's 7 years of age.
Oh my gosh. What sounds like a beautiful family.
Yeah, they're great.
All right. Well, let's go over the MRI, and then I can give you a sense of what to expect on the treatment options. Well, just to orient you, this is your back, and this way goes up toward your head, and this way goes down toward your bum. And if we went in at the level of your hips, straight in, we'd get to this L4, L5 level. This is a beautiful, healthy, normal disc. These 2 are basketball discs. Mm-hmm. This is your spinal canal here. and the white is the fluid. So the fluid's flowing down, everything's good. And then right here, there's an anaconda in the river. It just narrows down. Now, not all the way, right? There's still some space, but a lot. And then it opens back up and gets back to nearly normal. That is the source. That's the L4-5 stenosis narrowing. That's the image you should blast into your mind. And most of that narrowing is being caused by this herniated disc or this chronically bulging disc. Now, if we look in a different plane, if we look at the plane that's perpendicular, we see this. And as we go down to, this is the level above, this is your L3-4, and this triangular area is your spinal canal. That's a little bit narrowed. I want to ask you to sort of blaze this in your mind. It doesn't look like it, but this space right here is a joint. That's a facet joint. See, it's dark there?
Yes, sir.
That's the right side. Now, if we go on the left side, try as much as you can to remember this picture. And then we're going to go here. This is now your L4-5, and this is the joint. But now, instead of that dark line, the joint is a white line. Can you see that, or am I just making no sense?
Oh, no, I can see it very clearly, sir.
Yeah, so the reason that the joint went from a dark line to a white line is the white is swelling in the joint. So that joint at L4-5 on both sides is severely swollen. If this was your knee, this wouldn't be hard to understand because your knee would be twice the normal size and puffy, and you would look at it and go, oh, my knee's swollen and it hurts. It's my knee. You do have stenosis, but it's not much worse than the level above. Okay. So the first thing I want to talk through with you is what would standard treatment of the joint pain look like? And then we'll talk about the stenosis, and then we'll talk about this level, the L4-5. So standard treatment for joint pain is rest, a supportive back brace, you know, like the kind you get at Home Depot, just to take the weight off it while you're recovering. When a tooth is bad and we can't fix it, to make the pain stop, they do a root canal. They cut the pain fibers, ablate the pain fibers that go to that tooth, and you still have the socket, and they can put a fake tooth in there, but it doesn't hurt. Same approach here. There's little pain fibers called the medial branches, and they can go in and ablate those medial branches, and that is done with radiofrequency ablation. That treatment, which is often referred to as burning of the nerves, the technical name is radiofrequency ablation, or RFA. Before they go in and burn any nerves, is they block those little pain fibers. And the idea of the block is it's only going to last for a few hours, but if you get relief for those few hours, that would predict what you might get if they burned those same nerve fibers. Does that make sense?
Yes, diagnostic, right?
It's diagnostic. So it's, in fact, that's the name of it, diagnostic medial branch block. So you go in and get a diagnostic medial branch block. Let's say you get 100% relief. Boom, you go in for the RFA, you're done, right? No. So this is the real world. In theory, you'd be done, but in practice, it's 80, 60, 10. So 60% of people are going to get 80% pain relief for an average of 10 months. You're a relatively young man and you have stenosis and it only gets worse. You've had surgery at this level before. You have swelling in your facet joints. So one day, and the open-ended question is, what is that day? But at some point in your life, you're likely to need a fusion at L4-5. There's no other way to open up that spinal canal and treat the pain coming from those joints. You can kick that can down the road and pursue treatment with RFA until that is no longer effective, Or you could say, heck no, I'm going to get this over with and get the L4-5 fusion now and move on. You have to choose which way you're going. What is your thinking? You're employed, you got young kids. What, you want to kick the can or you want to deal with it now?
My gut tells me I want to kick the can at this juncture, just because of so many things that's happening personally at this juncture. But I have to face the music at some juncture, and I get that too.
If I were you, I'd kick the can. I have to tell you, I just feel like having young children at home is enough.
That
It's
it
just enough.
is.
It's a little bit of a risk. You're otherwise in good health, good heart, good lungs. Everything else is good.
Yeah, everything is pretty good. Yes, sir.
Yeah, I mean, it's always a risk, but your back problem is not a home run. This is your cross to bear. This is something you're going to have to deal with in one way or another, off and on throughout your life. So RFA, radiofrequency ablation, is your thing. There's a lot about it on my channel. I would check it out. There's a playlist on it, Facet pain and RFA, and learn all you can, but you got to find a doctor. Now, who gave you the PRP injection?
It was a phenomenal pain management doctor. His name is Dr. Munchie.
Okay.
And he was just fantastic.
Well, then he might be the right one to do the RFA.
Fantastic. Thank you so much, Dr. Lieberman.
You're welcome. Thank you for your work at Goodwill.